Welcome. Thank you all for being here. My name is Mike Curtin. I am the CEO of DC Central Kitchen. And while we have kitchen in our name and we serve 10,000 meals a day here in the District of Columbia, we know hunger is only a symptom of a much larger issue. We also know that food alone will never end hunger. And that's why our model has always focused on training individuals who have barriers to employment, like histories of incarceration, homelessness, and other traumas, for jobs in the culinary industry. Now, many of those folks are employed in hotels, restaurants, and caterers around town, some actually in this building. But over the years, we've developed a food-based social enterprise portfolio that employs over 100 of those graduates, leading the way, feeding their neighbors through programs in conjunction with schools, businesses, other nonprofits, and advocacy organizations. And this is why we have been very encouraged to hear what the White House is saying about the larger vision of job creation, collaboration, and thoughtful, targeted, systemic policy and innovation as a recipe to ending hunger. And that's what we're going to talk about here today, that recipe, specifically as it relates to challenges and opportunities in ensuring that families and children have access to the nutritious food that they need, including access through federal programs that connect families with nutrition support. And all of the leaders up here on this panel work to knock down barriers to food access that kids and families face every day. And they're committed to centering their work on the lived experiences of the people who face those barriers. So we're going to start off with Mark. And if you could tell us, in your experience with the union and your personal experience, what are the barriers you have seen and experienced most?
Thanks, Mike. Thank you, everybody, for being here. So honored to be here today. Look, a struggle for our members. Our members work in grocery stores, work around food all day. And in 2009, during the Great Recession, it became a real challenge for us to realize that people who work around food all day were going home hungry. It just seemed unjust and unfair. So we started a food pantry at our local to feed our members as their need increased. But we saw, as the Great Recession happened and our industries began to change, like 70% of our folks work part-time, that there was a disconnect between the employer and the worker as far as the social responsibility that one job should be able to provide for a family. So our members then began to have to enroll in SNAP and all these different programs, and it became very frustrating. But there's also, again, a path forward, but our members, 70% are part-time. Hours fluctuate, which means income fluctuates, which means it's hard to apply for programs when you don't have an income or it increases and then you become ineligible. So things like the expanded child tax credit are extremely important to our members. And by the way, as the president said, please make it permanent, right? Really, really important. But these things happen, and our members constantly face these struggles where they work two jobs or they can't because their schedules at work are unpredictable. So for us, it became about how do we support our members, get past these barriers. And it's funny because the barrier for some of them is their employment to programs. So we like to say one good job should be enough. And that's our goal, is to move towards those things. And these programs are really, really important. I'm a product of government programs. Food stamps, subsidized housing, medical care. These government programs work, but there's also a path forward, and private industry can step into that path or that space and make sure that people are provided a good job to support themselves, their family, and by extension, their community.
Thank you, Mark. Appreciate that. So Donna, one of the other barriers that we've seen in some of our work is a stigma that's attached to subsidized meals, free meals in schools. Is that, in your work in the schools in Georgia, is that been your experience, or is it really more of an infrastructure and systems issue that we're facing and dealing with?
Well, it's actually all of the above. There is a huge stigma attached to school meals being free. A lot of kids that qualify for free meals will not eat them because they're afraid their friends will know they're free. A lot of the kids that qualify for free meals will actually go through the a la carte line just so nobody knows that they qualify for free meals. A huge problem is a lack of inadequate resources. Our reimbursement rates do not adequately cover all the needs of the school nutrition program. One of the first problems is that, as everybody knows, food costs have been going up and up and up, and I can't, like a restaurant, raise my prices. And then the other issue is that we have a terrible problem with equipment in kitchens. We have kitchens that absolutely have no equipment. So we're asking them to prepare these gourmet meals on a griddle. And so they're unable to do that. Even if they can get an equipment grant, they do not have the infrastructure that is enabling them to put in this equipment. There's also a lack of nutrition education that teaches the kids why do they want to have access and choose to eat these healthy meals that we're providing every day. So the kids choose a candy bar over an apple because they don't know why they should be doing it. The last issue is the burdensome problems with operating the CACFP, which is the supper program and the summer feeding program. If you operate both programs, you should be able to operate breakfast and lunch and seamlessly go into operating supper and summer feeding. But we require you to operate two totally different programs that have different rules and different regulations, different food patterns. The kids are the same. Why should the food pattern not be the same? So we've got to break down those barriers so more people are able to do those kinds of things.
Excellent, thank you. We do a lot of school food, and we share those same frustrations. So Shannon, let's turn over here for a second. So for all the debate that we see in this town or in the talk about military spending, food insecurity among military families is a daily and I'd say an unconscionable reality that no one wants to talk about. Mm-hmm. Can you shine a little light on this issue for us and tell us more about what we want to pretend isn't there?
Absolutely. We wouldn't often put military families and food insecurity in the same sentence, or we wouldn't want to think that we would have to do that. But the reality is, according to recent data, that about 24% of active duty service members have experienced food insecurity in the last year. And that's from Department of Defense numbers that were released in July. I want to start off by saying we have made more progress recently than we have in many years leading up to this. So as an organization, we started looking at food insecurity among military families back in 2017 when we were hearing about it from our network. We tested it through research and we saw this was a real problem. The challenge was that people were responding, well, military is well paid, or oh, this isn't a problem, this is money mismanagement. So we set out to really understand what are the causal factors that lead to food insecurity among military families. And we found that they are pretty similar to other populations outside the military, but just a little bit more complicated. Things like the frequent moves. Every 2.5 years on average, military families move and they have this full reset, this understanding of new systems, enrolling in a new school, finding a new house. Military spouse unemployment has been a perennial challenge facing many. Issues around growing families or childcare or that unexpected expense that put people over the edge. But one of the key challenges that I think that we are really poised to address now is the stigma related to it. There is this culture of resilience in the military community that can make it really hard for people to ask for help. And so now that we have identified food insecurity as an issue and we have this roadmap that the government has helped work toward, we can really get at these solutions so that military families don't have to worry about food. There's enough that we all have to worry about.
Awesome, thank you. So, Shavana, let's talk about the challenges that Shannon has highlighted here and move that to other challenges surrounding access to critical problems, or critical programs. So one of the things we've done recently at DC Central Kitchen, we worked with DC Health and the local council to make access WIC benefits accessible in local corner stores for the first time ever. And this has been a literally life-changing and win-win situation for folks in these food insecure neighborhoods and merchants. Tell me about some of the innovations that you've been experiencing, using, developing to access these programs.
So we have had a lot of opportunities, especially over COVID in Louisiana, to make some intentional changes. One of the many things that we've done is partner with, I'm not sure if you've all heard of them, Urban Footprint, which really helps to use data to identify where are the food insecure parishes or areas within our state, and where can we do intentional and targeted outreach so that we can actually address food insecurity. We have a lot of rural areas in the state of Louisiana, and so a lot of times people don't even know what food stamps or SNAP is. And so we partner with a lot of community-based organizations now who is doing intentional and targeted outreach using that data to show them what are the zip codes that they actually need to reach out to for the individuals who have no food to eat. We've also been working on truly kind of building out this philosophy of a no wrong door. I'm sure you've all have heard of it over many, many years. You know, our secretary and our team have really been focusing on what does it really mean to be no wrong door. Most people come to our state agency because they want food stamps or they want cash benefits or they just need help. Oftentimes what we're able to give them is approval for food stamps or approval for cash assistance, but we can't address the child care. We can't address the housing crisis or the challenges that they have, even connecting to schools. And so we've worked with United Way and 211 to actually roll out the Unite Us platform where all of our staff will actually have access to address those other needs. So instead of saying you can pick up the phone and call this place, they can actually send a referral directly to that zip code in which that individual lives in so that they actually can get the resources and support they need. We're excited. We're going to be starting that here in the fall. We've also done some intentional changes about making sure we're addressing individuals who are actually in poverty. So in January of 2020, we doubled our TANF income limit, our TANF grant amount, which was bottom. We were ranked 50 in all of the states. In doubling that in January, we have actually moved to 28. Yes. So we have come to the national average, which is $485 for a household of 3. We've also implemented broad-based categorical eligibility in the world of SNAP, which really allows, thank you, which allows individuals to be at 200% of the federal poverty level in order for them to be able to, be eligible for SNAP benefits. It'll help take into things to account like housing and childcare and things of that nature. We've also worked with our IT department, I guess you can say, and actually rolling out a virtual process for issuing out disaster SNAP benefits. I know you all know over the last 2 years, since I've been in Louisiana, we've actually had 5 storms that have impacted our state, 5 hurricanes. In each one of those events, we implemented a virtual DSNAP model because we couldn't be on person because of COVID. We were able to serve almost 600,000 people on DSNAP benefits through a call center platform, so having everybody call in for us to provide resources and support to them. It was a challenge, right, of course, during the pandemic to kind of stand up that platform, but what was beautiful out of that is we were actually able to get the help of other states to call in and take some calls to help the citizens of Louisiana who've been severely impacted. You know, I have an amazing team of staff who, in almost every disaster that we've had, they've all been directly impacted. And they've been able to go stay at a hotel and still wanted to provide resources and support to other citizens in our state. So it was great to get help from Oklahoma, from Texas, to help us stand up that virtual process and issuing out disaster benefits. And I truly think that the virtual DSNAP will help us moving forward so that other states can support those states that are actually impacted by those events.
Thank you very much. Appreciate that. So, just a few minutes ago, we heard the president refer to what he's called his moonshot, ending cancer. So I'd like to ask all of our panelists up here, if you could, we'll call it the moonshot question. If you could pick one program, one policy to replicate, scale, reproduce that would make access to nutritious food easier for children and families, what would that be?
Well, I think, first off, I want to thank President Biden for his comments today. There are so many issues that we talked about, or he spoke about in his speech, about health, diet. And for us, as a president of my local, I also sit on our health fund. I'm a trustee. So we see the cost of healthcare going up all the time, right? So we see how these things are affected by our members not having access to healthy foods because they earn a low wage or they're running from place to place. But I think that if we were to look at something that could really kind of level the playing field for us, it would be something like the PRO Act that would give workers a voice at the table to be able to negotiate with their employers so they would be able to support their family. Those are really, really important things when it comes to solving these problems. My grocery job helped me, it helped me be able to take care of my family. My one good union job helped me take care of my family. That should be available to everybody. private industry has walked away, in my opinion, walked away from the idea that there was a partnership between the employer and the employee. And they have unburdened themselves of the cost of a lot of these wages or health care and put it onto the government. There's a space for everybody to succeed. And I think, Mike, if it was one moonshot for us in labor, it would be something like the PRO Act.
Great. Thank you. Janet.
It is not hard. Universal school meals, universal school meals, universal school meals. Or what I like to call healthy school meals for all. These meals are based on the dietary guidelines. We know by research they're the healthiest meals in America for children to eat. And by offering this, we would cut out the stigma, we'd cut out the lunch debt, no teachers would be hounding the kids, no managers would be calling up those parents, no manager in the line would be taking the tray away from Johnny, his favorite meal of spaghetti, and giving him a bologna sandwich. So that would take all of that away. And if we did that, we'd finally have time for nutrition education, which is what we need. We'd be teaching kids why they need to eat those green leafy vegetables and those whole grains, and they'd be excited about it. And that Fresh Fruit and Vegetable Grant program just allows them a gateway into learning how to eat healthy. The last thing that we need is USDA to have permanent nutrition nationwide waiver authority. For the last 2 summers, I was able to produce the most amazing meals that I sent home to my families. And my children would say their favorite part about the meals was opening up the meal and looking in there. It was like Christmas. They'd be getting fresh broccoli and fresh asparagus and blueberries and strawberries and local peaches and local things. And we were actually teaching them how to eat healthy, and in turn, they were teaching their parents how to eat healthy. They were learning how to cook. So we know with nutrition education the 3 things: that if they grow it, they will eat it; if they cook it, they will eat it; and if they taste test it, they will eat it. I had a middle schooler who did a Charlie Cart cooking class, and I saw him at the end of the class. He said, "This has been the best day of my life." And I said, "What?" He said, "This is the best day of my life." And he was cooking asparagus and Brussels sprouts, and it was the best day of his life. That's what we can do. So in this summer, we need those flexibilities because we don't have bus drivers, and we have a rural community, and we need those bus drivers. So being able to provide multiple meals allowed us to go out on different days to different parts of the community and feed my kids. So I'd like to say that Healthy School Meals for All is not a food security program, but a nutrition security program. This is our opportunity to teach kids how to eat healthy, and guess who they're going to go home and teach? They're going to teach their parents how to eat healthy. And so we have got to stop this chronic incidence of rising of obesity, diabetes, and hypertension as children, set them up for lifelong good eating habits, and school meals are the way to do that. School meals are a very important part of the meal day, guys. It's just like having books, transportation, teaching. Why do we ask people to pay for school meals when we don't ask them to pay for those things? If you can afford to pay for school meals, they say you should have to pay for them. Well, if you can afford to pay for school meals, you can afford to pay for your books and stuff, but we don't ask people to do that. So my job is to provide teachers with kids ready to learn. So I've got to give them breakfast, lunch, supper, and feed them in the summer, because that academic slide in the summer is real, people. And you can't just have food to eat. You have to have healthy food to eat. And it's terrible when a teacher tells me, I'm putting the kid in summer school not because they're not passing their grades, but because they need food. That is horrible. The last thing is that we know that Healthy School Meals for All will improve health, improve academics, and support local agriculture. And we have this moonshot opportunity to do this, and listening to Biden and Vilsack, it sounds like they're on the same page. So let's go for it. Our kids are worth it, and we can do this together, guys. Thank you.
Thank you, Donna. Janet,
Yes.
your moonshot.
Really a level playing field for military families. When you think about that move every 2.5 years, military families are pros at packing. We're pros at unpacking. We're really, really skilled at hanging things up on the walls. But what's hard to do is figure out that local community. Figure out where you can go for child care support. Figure out the enrollment in schools. Figuring out where you can live. But if you add on top of that, navigating different policies, different eligibility, we're hearing of families who are moving from California to North Carolina, a place where there are free meals to a place where there are not. And families expected that their kids would have that support. Now they're getting to those schools and it's not available. Parents are panicked. And then there is this backlog, right? Okay, it's gonna take us about 4 weeks to get your kid enrolled in this program. Well, that issue compounds, and it adds stress, right? So we need to figure out how we can create consistency so that the families who are asking to move all the time, we're not choosing to move. It's not just because we like to do it for fun. It's because this is what the country requires us to do. But let's figure out how we can make it easier and fair and equitable state to state so that families don't have to worry, okay, I have to figure out my budget. It's gonna be different in this state because we don't have this resource that we had here. Well, the meals program will make a huge difference there for military families, and I'm really excited about that proposal.
Great. Thank you. Joanna.
So as a state agency, our core is just really to get the benefits to individuals who need them, right? So give them assistance for food, give them the cash assistance they need. But one of the great opportunities we have with the federal programs that are in place is to empower individuals and give them encouraging and motivation so that they can actually get a job, so that they are not reliant on those government programs, so that they know that they can take care of themselves, they can take care of their families afterwards. And so a lot of our focus has been over this last 2 years of not only connecting individuals to benefits, but really connecting individuals to workforce development activities to actually help lift them out of poverty. And so we've created a workforce development section, which really just moves all of the employment and training programs that are embedded within all of the federal programs and those requirements to one area to make it a seamless process, which is what we like to think of it as, so that individuals can actually start going to school to get their education while they're still receiving assistance from the state, to start doing on-the-job training while they're still taking care of their families, and hopefully to actually gain employment at the end to where they won't be reliant on government programs and benefits anymore. It's great that, Biden announced, and they talked a little bit earlier, I think Vilsack said it also, about the increase they've made in SNAP benefits, the increase that they've made to the families and the children, but it's still not enough, right? We still know that there's more that needs to be done. And what our clients tell us often is that they don't want to be on these programs anyway, but they don't understand how the pathway to getting off of those programs. So what can we do? We have a large team who really focuses on empowering, motivating, coaching individuals that are on SNAP, that are on TANF programs. And recently, we got awarded from Office of Child Support Enforcement $20 million to actually provide resources for individuals that are part of the child support system as well. And so it really is aligning all of those employment and training programs to make it easier for someone to go through the process and actually be able to end with a job, but start with maybe a stackable certificate when they start. A job that they're going to be proud of, a job that they actually will succeed in, after they're done with their training, so that they don't have to worry about coming back on the programs that we have.
Thank you. Great. So for DC Central Kitchen, our moonshot is actually under construction right now, just a couple miles from here. When our new 36,000 square foot facility is complete, it'll be the country's most innovative and ambitious community food hub. In that space, we will be able to double our work with our award-winning culinary job training program. We'll be able to double our farm-to-school programs, and we'll really be able to increase our Healthy Corners program, which has been supported by the GUSNIP, or the Gus Schumacher Nutrition Incentive Program, which brings healthy food, fresh fruits and vegetables to corner stores in our nation's food apartheid areas. So this allows individuals to use their WIC and SNAP benefits right in their own neighborhoods, a win-win-win situation for the individuals that are facing food insecurity and the merchants in these communities. And all of these programs together are going to be housed in this one center that is all of these programs ripe for scaling through the USDA, the SNAP Employment and Training Program, the GUSNIP program, the Community Food Project, and the USDA School Food Program. And lastly, the notion that DC Central Kitchen, a social enterprise-based nonprofit, is the retail anchor tenant of a large mixed-use development is, I think, staggering and probably the first time this has ever happened in our country. So if we could change that paradigm and that thought model to look at the work that organizations like these represented on this dais today are doing in our community, not as charity, but as community development and economic development for our communities and our neighborhoods, I think we're all going to be in a better place. So that's what I would like to see as our moonshot. So we're going to combine, I've gotten a couple questions here that have come in online and from the room here. So given that a good number of the folks that are joining us today are joining virtually out there, let's just ask all the panelists, what would you want them to take away from this and bring back to their communities to lean into what we're talking about here? How can they be part of this administration's plan to end hunger by 2030? Mark, you want to start?
Yeah, sure, thanks. Well, one thing, Donna, to piggyback off of the free school meals, from California, the state of California has just instituted 2 free meals, school meals per day for kids in schools, public or private. So really, really happy about California doing that. But it also takes, I think, Mike, it's going to take the idea of what we heard earlier. It's about bipartisanship. It's about finding solutions together that can work for our communities, that we have become a country divided and unwilling to listen to each other. And if we step back and we actually see this problem, hunger, nutrition, health, as something that affects every single one of us, just like the president said about cancer, right? It affects all of us. If we could all set down whatever our D or R is and just focus on the problem, I think that we as a country can really move forward to solve big, big issues. But I think along with those, whether it's all of these very worthy causes that we're hearing up here, that people being able to go to work, take care of their family, take care of their community, means that they are more able to take care of and support programs like we heard about here. And I think if we do those things collaboratively, then we're on a road to success.
Awesome. Thank you, Mark. Appreciate it. Yes. We can do that. Joanna, let's mix it up a little.
So I love what the president said when he said be innovative, be creative. I mean, we have a ripe opportunity now to do things differently, especially as state agencies. There's so much flexibility that has come through this administration that we have opportunities to do things differently and for the federal government to be supportive of those things that are different. Not only that, but there's a lot of communities who know exactly what the need is. So how do we put ourselves in those spaces to listen to what those with lived experience have to offer, to really bring about what could be from their vantage point, to make it really happen with the changes that are allowable currently. There's so much flexibility. I mean, I've been doing this work in this space for over 20-something years between Louisiana and Washington State. And I remember 15 years ago, we were still talking about college food insecurity on campuses, right? And it hasn't gone away. College food insecurity still exists, but we made such great progress over the last two years, really, during COVID. I hope that the federal government keeps a lot of those flexibilities in place, making more college students eligible, increasing the limits like they have recently, allowing states to be very flexible in adopting telephonic signatures and adopting all of these different policies and practices. And I think for many states, it's easy to be stifled, so I think if we can continue to work as a community, make sure we have lived experience in all the decisions we make, use the data that we've learned over the last 2 years to really make impactful change, and be intentional in our efforts, we can do some amazing things.
Great, thank you. Donna, what do you want to say to the audience out there?
I would like families and the communities to support school lunch. Our meals are so healthy, they are so nutritious, and they're 10 times better than what you're packing and sending to school. So if your kids are going to learn to eat this healthy food, you just need to bite the bullet and encourage them to eat our healthy meals. I'd also like you to think about coming to work for us in school nutrition. We have a lot of job openings. And the great thing about that is we're on the same schedule as your kids are. You get weekends off, holidays off, and you get a healthy school lunch every single day. I'd also like to encourage you, if you're a farmer out there, I always tell my farmers, I'll buy and serve anything you will grow for me. And they grow for me. So if you're a farmer out there and you want a ready market, go to your school nutrition program. You can start out small and then you can grow and grow and grow, but we know that local food tastes so much better. Our kids know when it's local. If we have our local collard greens, they eat the fire out of them, but when I have to buy store-bought ones, they're So, I mean, they really know, and they know my farmers, and they don't ask anymore what a pickle plant is, what it looks like. They know that where food comes from. So we have got to change our kids, and we've got to change our communities. So come eat with us, come work for us, and come grow for us.
All right. So, one thing everyone out there, and actually people in here can't even see either, is someone who's pioneered healthy school food for years. Chef Ann Cooper is standing up right here and smiling like you wouldn't believe it. When we started school food, I remember being on one of these panels and wandered into the room, and I was terrified that what I was going to say. So I hope we've lived up to your standards, Chef. Shannon.
I think it's recognizing two things. One, people are busy, right? So if people are coming to you looking for support in one area, let's figure out how we can make it easier to get support in other areas. So if they're coming for support with housing, how are you doing with food? And by asking that question proactively, you lower the stigma, you lower the barrier to entry. And so let's realize that people are busy, and let's realize that it's really hard to ask for help. And so if we can adjust our framing with those things in mind, I think will make it a lot easier for the families we all serve.
So, this has been alluded to during the course of our conversation here and through a couple answers, but I'm wondering if anyone up here wanted to address maybe more directly or in a more focused manner, the president's call to make sure that we are centering and focusing racial equity as part of this effort, moving towards eliminating hunger in America by 2030. So are there any programs or particular things you've been associated with, your organizations are doing that are making sure that we keep that front and center as we continue this work? And I'll just leave that open if anyone wants to jump in.
I'll jump in.
Okay.
So because we've done some great work in Louisiana, we created our first department within the state, Diversity, Equity, Inclusion, and Belonging Committee within DCFS. And what they've really done is really to ensure that our staff have a voice and ensure that we are creating policies and programs and procedures that is not excluding any individual or any group. We've been able to look at policies that we've actually implemented to see who are we leaving out, who is at the table. Are we addressing race, ethnicity? Are we addressing rural versus urban areas? Like, are we really creating solutions that's gonna fit for everybody? And so it's great to have a leadership that is really committed to making those changes, but really committed to, after we're implementing a policy, to making sure we're not doing harm while we're making those changes as well.
Yep, great.
I'd like to jump in too. Some of the things that we do is by offering this supper program, we've been able to encourage kids to stay after school to get tutored, and we've seen our graduation rates increase tremendously. We also had a malnourished football team, and the coach came to me and said, what can I do? These kids are not getting enough to eat at home. They can't finish practice. They can't finish the games. And I said, we can offer supper. So he encouraged them to start eating supper, and we won our first ever state football championship, and he credited the school nutrition program for the win. So that some of our kids that are disadvantaged, their only opportunity to go to college is to maybe get an athletic scholarship. And by being able to feed them meals and keep them well nourished and keep them on the team, I think that's providing a lot of equity. And I think our summer meals program, we ensure that all our kids do not suffer from that academic slide. So when they come back to school, they're on the same tier as every other kid in my community that has access to healthy meals. I think it's a game changer. And we need those waivers, guys.
So one thing I'll just throw in, I think those of us in the social sector are often, we're quick to call out those in the public sector maybe that are trying to guide the work that we do. We like to think that we know better than those that sometimes are supporting that work. And I think that sometimes, unfortunately, we might think that we know better what we should do for those that are experiencing food insecurity and are facing these barriers without asking what they really want and what those barriers are. And I think that we need to continue to center our work there. At the kitchen, again, over half of our staff are graduates of our culinary job training program. And we make sure that those folks are moving through career pathway plans, through the organization to continue to drive our leadership and our vision into the future. So that's, I think, something that we all need to make sure that we're good at looking out. I think our sector in particular, we need to make sure we're always looking back in and holding that bright mirror up to ourselves. So one last quick question that we got from the audience, and I think this is probably Shavana. How can we help college students? And what do we do about the SNAP benefit cliff?
So there's a few things. So for college students specifically, I think there's just a lack of awareness. I think there's a lack of understanding on what the eligibility is when it comes to food assistance. When, I want to say in 2020, when the federal regulations changed, I don't think students realized what the change was. I think the way that we communicate, the way that we inform those that we make decisions is sometimes a challenge. We've been working with a lot of our colleges and our universities to make sure we get accurate information out and very easy, simple understanding of what is the process itself. So as a college student, what am I looking for? I know I'm not working, right? So what are you all looking for when you're determining eligibility for me? So we did put out a fact sheet. There's like one-pagers, I think even USDA has made available to some states as resources. A one-pager that you can give out to the colleges, to students to say, these are the eligibility requirements. If you can check these 3 boxes, you need to go to your local office and apply for the program. Since we've been doing some intentional and targeted outreach, we have seen an increase in the number of college students who are actually accessing SNAP benefits in our state. And we continue to work with the colleges. We work with the financial aid offices, but I'll tell you the most effective have been really working with the student unions. The student unions who run the food banks on campus are really where all the students go when they need food, when they need assistance. And so I think historically we've had this information like in the financial aid office or in the registrars or under advisors, but that's not where students go when they're hungry. That's not where they're going when they're trying to access resources. So the student union has been a great resource that we've seen in several of our universities and really helping students understand what is the eligibility, where do I go to apply, and what is the process. So the better we can do on being clear on those steps, making it really easy, once again, for people to apply for our programs, I think we'll really be able to address some of the food insecurity that exists on college campuses through SNAP.
Thank you. Thank you.
Mike, if you don't mind.
Sure.
One thing that I'm really, really proud of our union, United Food and Commercial Workers Union, is we instituted free college for all of our members and their family members. They could take online courses from an accredited school. So the idea of not having to spend money on classes means that you have money for food and rent and everything else it takes to live, right? We run into a bit of an administrative snag, but we're hoping to work it out. But talking to our members who are taking classes, because again, our schedules are all over the place in the grocery industry. They can do their homework whenever they want because it's an online course, right? We had recently moved into people being able to get their bachelor's degree online, right? So those kinds of programs support college students, they support families. Look, when I was going to college, I wanted to be a foreign service officer. And what I tell our members is, I didn't fail because I didn't become a foreign service officer. My life took a different direction, and I found a job and I found a career that I absolutely love, and I want this job to be that for you, if that's what happens. But there are a lot of different programs, and I think when unions get involved, there's a lot of things that we can do to uplift folks. And unions should be, I always say our union hall should be a community hall, and we should work together with our community to uplift people.
Thank you, Mark. So I'd like to, first of all, thank our panelists. The work you all do is so important, not just in the community, but for examples and that the administration can work with moving forward. I'd like to just, a couple quick thoughts is, first of all, solving hunger, ending hunger is doable. We have everything we need. It is entirely within our capacity to do this. We need to continue to lift up the perspectives of those who are facing food insecurity and hold our work accountable to them. We need to break out of our silos and work across our sectors to find and identify and scale the programs that work. And most importantly, we need to summon the political and social will to make ending hunger a priority, so that once and for all, we can end hunger in America. Thank you all very much for being here. Have a great rest of the conference.